Oh my God. I've never felt that in my entire life. Every single vertebrae in my spine just popped.
How's it even possible?
Wow. Ow. Ow. You enjoy this, don't you? I feel like $1 million right now.
What's going on out there in YouTube land? Today we are with model extraordinaire, athlete, Matt Nozka. He's had a few things going on with his body. He was in a really, really bad motorcycle accident. He's full of titanium and metal now. He's got, surgeries in the thigh, surgeries in the shin, had a whole bunch of different fractures. So we're gonna work with him today, see how much range of motion and pain we can improve with, teach him some exercises to keep this away in the future, and hopefully make him, feel as good as he looks.
Let's do it.
What were you dealing with before your motorcycle accident? And then tell me the consequences, exactly what surgeries you had done and how those have started to affect your regular life, your career, and all those things.
Right, I've been an athlete my whole life. Played college basketball, played every sport that you could possibly think of, but I never really had any injuries. I mean, the normal ankle sprains and things like that. But when I got in this accident 2 years ago, it really kind of just shook my world. I broke both of my femurs. I shattered my forearm, my tibia. This is a tibia, right? Mm-hmm. Shattered my tibia. So I had a what is it called when they take a skin graft?
Yeah, graft.
So they did a graft for this. They took the muscle, ligaments, and skin to replace my calf muscle, my Achilles, and a bunch of other stuff that was in there. There is now a titanium rod from my knee to my hip, from my wrist to my elbow. And there is, I lost some bone in my hip, so there's a missing piece, so it grinds. Tore both ACLs, LCLs, PCLs, and meniscus in both knees. So we're pretty banged up, but it's 2 years after. I've done a lot of rehab on my own, just having knowledge within sports. It gets to a certain point where you can't do much. I have those pins in there now, which give me a lot of problems when I'm doing leg exercises and things like that. So I definitely want to hone in on my mobility and kind of getting my my body aligned again. I got hit at nighttime, and then I got rushed into the ER. Went straight to surgery. Lost a lot of blood. Had 5 blood transfusions, and I think I've done 22 surgeries in total, but they were all in that same time frame. So February 26th was the accident. Within those 2 weeks, I had the 22 surgeries.
Wow. You still ride?
No.
Okay. Never again?
No. I wouldn't say never again. I mean, I have a lot of family, and now I have a kid on the way, so.
Is it never again?
Yeah. It's more of a maybe
that
when
look, there was a
maybe when I'm when I'm 60, my kids are grown up, I might buy myself a hog and cruise down the coast or something like that. But who knows?
That was a setup question.
Yeah. she gave me a...
Yeah, I was waiting for the death glare.
She was like,
Look down all the way. That pulls.
Did you hear it? It's already started.
When you get into an accident like that, add on posture, but basically what happens, the muscles guard up and the fascia over the top of it starts to lay down and get thicker and thicker and thicker. And if you don't get through that part of it first, it's really hard for the mobility stuff to do anything for you.
Right.
So once you get through that outer shell and you get everything moving, then you can maintain that or even push further with that, with yoga, stretching, all that.
That's what I definitely want to dive more into.
Where'd you play at?
I played at a D2 school in Pittsburgh.
You're from Pennsylvania?
Yeah, I'm from Pittsburgh. Oh, man's got some strong hands. Jeez.
What position?
Like a shooting guard. Okay. In between point guard, shooting guard. I thought I wanted to play professional basketball, and then I ended up falling into modeling, and modeling led to acting, and now we're here.
And how did that happen?
I had a friend of mine that was trying to be a model, and I ran into him one night, and he was telling me that he went up to New York and visited this agency. And that I should check it out. So we end up following each other on Instagram, and one of the agents that he had met with actually DM'd me and was like, hey, did you ever think about modeling before? Think you'd be really good at it? Asked for shirtless photos. And that's when I was like, all right, this isn't gonna happen. But he was very
sliding your DMs asking for shirtless pictures.
Right. So I was like, okay, yeah, you're a modeling agent. But I had my mom do some detective work and looked into him. He actually was a legit agent at a very big agency, and I sent him some shirtless photos from the gym, which felt really weird, but he called me within an hour or two and said that he had booked me to a Nike presentation. And I was waiting tables at this Lebanese restaurant, making probably like, you know, 60, 80 bucks on a good night. And it was, I think it was like 750 or 800 bucks for the day. And I was losing my shit. I was like, what? So we drove up to New York. I did the job, and I kind of was back and forth every, like, probably twice a week.
It's like, wait tables or stand there and look pensive.
Yeah, it was so cool. And I was like, all right, this is definitely something I want to look into.
Yeah.
Holy. Oh my God. I'm going to cry.
Me too.
Oh. Got hard to maintain being a full-time student and traveling, playing basketball. I went to my coach and I was like, hey, listen, because I was on a full ride.
Okay.
My coach was actually super supportive.
Wow.
He was like, you know what? Because I told him how much I made that day.
He
was like, dude, yeah, he's like, dude, you just give it a shot. You can always go back to school. We'll be here. So I ended up dropping out.
So you're not going back, is what you're saying?
Was not advised by anyone that I asked, but my coach, he was literally the only one who was like, dude, just take a stab at it. I ended up moving to New York for a couple, probably like 6 months, and eventually Ellen had me on her show. And when that kind of happened, it kind of turned my eyes towards like the acting thing and moving to California. Oh my goodness, I'm sweating just from him literally digging into my shoulder.
Look down. Gosh. I'm salty because I don't have any followers on there, so I'm like, whatever, ban it.
Yeah, like, yeah,
whatever.
Need it anyway.
Do a dance, man.
I'm not doing a dance. Not happening. I'm old. See this gray in the beard? That means no TikTok dances.
Anana's been making me do the TikToks with her.
Yeah.
They take a lot of effort. Like, they're not, it's not like...
Shoot it again. A lot of takes, huh?
Yeah.
I'm a one-take Jake guy, man. I don't...
We'll take Jake.
I shut down when you want me to do the same thing again.
Oh.
It's 50-50. The right's the easier way to go. Head back to center. And again to the left.
But, I can feel it in my brain, literally. Oh my gosh.
The one finger tap out.
Oh, holy shit.
There's a trigger point.
Oh my goodness. I can literally feel that in my brain.
It'll fade out in a few seconds here.
You should find someone that's never swore in their life and do this to them. I'm not even joking, it like circled my whole area right here, like all around my brain.
That's where people get like headaches or what they call migraines. A lot of it comes from those areas.
Oh man.
Migraine is a very specific type of headache, and so they'll go get on meds or whatever, and it doesn't really help that much because really the problem is coming from their neck. Really, they just need, good neck work. I mean, you can see how tense that is right there.
Yeah,
When I push right there, you can see the tissue flow all the way through. That's when the fascia's tight. Not only do we need to break the fascia up, but the soft tissue has to be loose enough and limber enough for an adjustment to even set. Otherwise, the soft tissue will fight that movement.
Where are you from originally?
I'm from New Mexico.
I love Mexico. So much easier now.
There you go. Now when you feel in your soul too, like, like through your lungs.
Oh my gosh, that's all the way down through my fingers. It's insane how you feel it just fade away. Like the first initial like 3 or 4 is like, holy shit.
Brutal. Yeah, lats opened up here. See the whip in the shoulders.
Yeah.
Immediately. Feel that like sit down and back.
Yeah.
Stuck right there and like right there.
Yeah, those are if I do get a headache, those are the 2 areas that I really push on a lot.
And right's worse than left?
Yeah.
Generally, yeah, totally. I'm gonna clear that lower edge first.
Oh my goodness.
There we go.
That's insane.
We'll clip this one up top.
Perfect. Cracked before you even did it.
Yeah, there was one in there for sure. That one really needed to move.
Holy shit.
There we go.
Man, you guys hear that? How could you not? People upstairs heard it.
And then we're gonna traction you, so it's gonna decompress the center part of your spine.
Oh my God. I've never felt that in my entire life. Every single vertebrae in my spine just popped. From literally my lower back all the way up to my neck. Oh my gosh.
How's that even possible?
That's
Whoa.
the moneymaker right there.
Wow. That's insane.
So yeah, it's the tennis. You should feel like more mobility through that center part.
Yeah, like what the heck?
Yeah.
That's nuts.
Pretty good.
Oh my God. Wow. That's insane.
I feel like you guys just ripped me apart. But then it all just fell back into place.
Yeah.
Shit.
Reach.
Ah. Oh.
Let's go through every syllable there, every vowel there. I. Oh. Hey. You. There we go. And we're clear. Gotta even you out. Same thing over here. This one shouldn't be quite as bad.
No, it's not. Wow, that's weird. Why is that?
For whatever reason, whatever your balance is, your left pec gets used more than your right.
Am I right?
Your right is more like lat subscap area. You could see it lying down. This side was sticking up higher on the left.
Yeah, like this side doesn't hurt at all really when you're doing that. This was killing me.
Yeah, there's still a little more on the medial aspect right here. I can still see.
Oh.
Wow. Now my shoulders are on the table. That's nuts.
Like that's where they're supposed to be, right? Right there.
Oh my god.
And even some of the fascial lines underneath the pec, like where that fascia attaches to the ribs, like to try to get extension of the T-spine. I think all that stuff helps a bunch too. I'd play them over a Bosu ball and get in there.
Oh. Whew. Now I'm thinking like, if I'm gonna be working out, how am I gonna not have this done anymore? Like, this is crazy. I feel so much better already.
Now he's addicted.
Yeah,
We're gonna show you some self-rehab stuff to help maintain.
Yeah,
as much
please
as you can.
do.
And really, like when we do these sessions, it's to identify, because everybody has patterns, whether they're from injuries or lifestyle or genetics, whatever.
Right.
And those patterns typically lead to chronic issues. So if you know what your pattern is, it's pretty easy to take care of yourself once you've had them identified and are taught what to do with them.
Oh my god. Oh.
So, that way. So straight down with the leg.
Ow.
Down, back up. So the model industry, they have like specific looks, because I think a lot of people are like, all right, it's gonna be Magnum, Ferrari, Blue Steel. Do you have any named like?
For me,
your own?
when I first started, because I had zero experience with it, I like looked at like GQ magazine and would just go through the photos and just be like, all right, kind of simulated it the same as like watching basketball moves.
Okay.
Like growing up, I'd watch YouTube videos of, you know, Jordan and Dennis Rodman, Pippen, all the greats, Larry Bird, Magic, and I'd try to, you
How old are
know,
you?
emulate their moves. 27.
Benching too heavy.
Too much
Being
weight.
a dummy. And then it was a weird spot in the territory where they couldn't do surgery on it, because sometimes, depending on where it is, they can just drill it right back into the bone, the tendon part, and then it'll heal and look normal. But mine was muscle tendon junction, so it just rolled all the way
and they
down.
couldn't do anything for it.
Nah. It sounded like a wet towel tearing. I felt it, and I would grab my chest, and I was like, oh no, did I tear my pec? But it didn't really hurt.
Really?
Not yet. So
Right.
I was like,
And then the next day was probably just black and blue.
I was like, I think I'm okay. And I went to go do like some tricep push downs, and I was like, zing, and I was like, oh, nope, not okay.
Not okay.
So then I just did legs. I just went and did leg press, because like, what are you gonna do? Like, I don't know.
You tore your pec and then did
I guess a lot of
legs.
people go to the ER or something.
Go to the hospital.
Call it a day. And
What are you gonna do? I don't know, man.
no, I went and did legs, and then I went and laid in the tanning booth for like 5 minutes. ACL is a support structure. So you don't want to loosen up a knee on an ACL side,
Right.
Because you need the tendon to hold everything together. But on a meniscus side, a lot of times you get secondary inflammation in the tendon. So if we work on that, it can get better. I've got a pretty nasty meniscus tear in my right knee, and doesn't really give me a problem.
Is it a necessary thing to repair them, or
Not
is it-
always.
No.
It just depends. So what they'll tell you is if it's a really bad one, if you don't get it repaired, it might lead you to more early onset arthritis, which means an earlier knee replacement.
Gotcha.
And odds are,
I'm getting one for sure. That's what I've kind of just set my mind to, like, all right, even if I do get them replaced, I'm gonna have like a real knee replacement eventually.
But you want to push it off as long as you possibly can.
Right.
And then obviously technology improves a lot over time.
Oh my gosh. Yeah. Ouch. Oh. I don't mind the scars. At first I was worried that I was gonna lose a lot of work because this guy in here is like ridiculous.
What kind of pictures you taking, man?
Well, if you do an underwear campaign, like when I did the Calvin Klein underwear campaign, they had to Photoshop all those scars out, which was not, I mean, it was nice of them to book me and take
Right.
that on as a task.
Sure.
I still can't believe that one where you pulled me apart. Thinking about when I first laid down, my shoulders were up like this, and my lower back wasn't touching the thing. But now, like laying flat,
I can lay flat.
yeah, like I can completely lay flat and feel my body on the whole bench.
That's a spicy one.
Oh man! Oh, holy
Dude.
Oh my god! I'm just refraining so heavily from cussing. Ah, mother! Oh.
My bad.
Oh, it's like weird. It's super painful, but then as you get there, it's like, all right, wow, this is
fade out.
Yeah, it fades out, but then you just feel so much more mobility. Wow. Oh my gosh. So what is that you're putting?
That one's the TFL, the tensor fascia latte.
That's super tight. That was the worst.
Well, given what's happened, your hips and your knees, and then the limping, it's not really surprising. Super tight.
Mother.
You know what the capital of Djibouti is?
No.
It's Djibouti.
Djibouti. Where is Djibouti?
The Horn of Africa. The capital of Panama is?
Panama? Oh my god.
You know the capital of Venezuela is?
It's not Venezuela, is it?
Trick question. Got him. You caught me.
You get to the third one, and I'm like, I'm gonna need readjusted because all my back is just tensed.
There we go.
I feel taller.
Standing taller.
I don't know why, but I really do.
Yeah, you're definitely standing taller.
Oh my gosh. I have friends that are like iffy about chiropractors. They're like, those guys are like, oh, chiropractors. And I'm like, dude, because I've been to a few. I've never went like religiously or done it. But there's no way that this doesn't work. Like, I feel like $1 million right now. Oh my gosh, holy shit. It's like my shoulders are back and down. I feel completely centered. Sometimes when I get up, my feet don't feel like they're level on the ground, if that makes sense.
Makes perfect sense.
And like right now, I feel completely centered. Like this is nuts.
There's a paradigm too, because like this would be like saying just clean your teeth work. Well, yeah, but it's not a permanent fix. The point of that is to get them clean enough to where you can maintain it for yourself for 6 months,
Right.
by teaching somebody how to brush and floss and those kind of things. So the musculoskeletal system is a lot more complicated than just brushing. So if they're not really teaching or learning the exercises, then yeah, it's going to feel great for a week or two, and then your chronic issues are going to come back if you're not maintaining. That's why the exercise that we teach are so vitally important. Mm-hmm. So we always tell people, if you don't do them, then you're going to have to come back and get treated more often.
Right.
And there are unethical people that want you to do that because that's how they make a living.
Right.
So we always say that if we teach people how to take care of themselves, they're going to refer in so many people. We never have to do that with anybody.
Right, exactly.
And there's personality types. Some people want to take care of themselves. We have some wealthy people like, I'm not going to do any of these stupid exercises you teach me.
I just want you to do it for me.
Yeah, so we're not going to be like, all right, you're not allowed to come see us.
Right.
We would prefer you do them, but they're just not going to do it. And that's a personality type, right?
The mobility movement of everything right now,
that
it
looks
just
good.
feels great. Wow.
Looks real good there. Very oblique here. So tilt to your right. Yeah, you're definitely standing taller. We were closer earlier. Like,
I swear, I stood up and I was like, I definitely feel taller.
Yeah.
I highly recommend this for absolutely everyone. Like, this is just insane. Oh my gosh. This guy's a saint.
And then lean back a little bit. Look up. Deep breath in. And out.
Oh, I didn't think there was anything left to crack.
After the big one?
Yeah, holy crap.
That should be a little bad for the shoulder blades.
That felt good through the shoulder blades right up in here. Oh.
Try to keep that bomb down.
Oh my. Oh my god. Oh, he's alright. He's alright. Wow, holy shit. That's where it's tight too, because I noticed training growing up, I wasn't really knowledgeable about like what to do to balance out your body. Mm-hmm. So I did a lot of chest and I noticed my shoulders pulled forward. So where you were just getting into was a super triggered area. Oh my gosh.
For sure, especially with that right hand shooting. Because like with what we do, the manipulation, it's a component, it's a tool. So the other things, without the other things, it's not that effective. We don't loosen up your muscles, we don't get your shoulder blades rotated back. Mm-hmm. You can clear the joints, but they're not gonna do it.
Right.
Same thing the other direction. Like if you just do the muscle work, we don't clear the joints.
That's why I feel like people that are uneducated about chiropractors and think it's just like a quack situation. Yeah. They just think, oh, he's just cracking this, it's not good, that. But it's really the point of getting my body aligned,
Like today, oh my gosh.
Well, it's part of a team too. So like if you look at every NFL team has one. They also have a physical therapist. They also have a massage therapist. You know, the Olympic Center, the head of the sports medicine for the U.S. Olympic team is a chiropractor. You know, so they have a whole team of chiros, massage, PT, they have a few acupuncturists now because all of those things work when they're used appropriately. Just like medicine, right? Like every medicine works when used appropriately. You wouldn't throw antibiotics at everybody.
Tati?
Wow.
Oh my gosh.
Did it hurt you?
I mean, there's pain, but at the end of the pain is the light at the end of the tunnel. You should have heard, wait till you watch this video, my back cracked from the bottom of my tailbone all the way to my neck.
Please don't hurt me. I love it.
I feel like $1 million. If you're training regularly, you know, 5-6 days a week, would you recommend someone that has obviously the money to come in how many times, like a week, a month? Like what would be the norm for that? Because for me, I would do that like 3 times a week.
The highest level athletes pretty much all have a guy. LeBron has a guy.
Right.
James Harden has a guy. You know, Tom Brady has a guy that basically they pay and they follow them around and work on them 2 or 3 times a week. But you know, when you have that kind of resource and everything, you're also not going to spend all this time rolling out. You're going to pay somebody to roll you out, right? So,
exactly.
you know, when they have the capability to do that, a lot of people will do that. And then plus that person's only focused on them. They only know their body, so they're not getting distracted by other people or mixing up their cases. So, you know, a lot of the highest level people have their own person. When their body's the way they make a living, it's a big deal.
It's a big deal, yeah. I mean, LeBron spends over $1 million
on his body a year.
If I had it, I would.
You and me both, brother. I just train all my guys to take care of me so that they can fix me as needed. Most healthy people, if they're pretty active and they're taking a good care of their body, they'll maybe get once or twice a year if they're really doing all the other stuff.
Oh my gosh. That's so tight. Oh.
And the stuff we're doing isn't necessarily specific to chiropractors. Like Dr. Carlos is a physical therapist.
Right.
And we both treat almost the exact same way. So we use all the modalities when necessary, whether it's manipulation, soft tissue moves, dry needling, you know, everything has its place. And the whole point is being holistic and finding the right thing for the right body part for the right patient, for the right age, the right demographic.
The best tool for the job.
Yeah. Like you wouldn't try to use a hammer to, you know, for a screw.
Right, exactly.
So you need to have all those tools in your toolkit to be able to pull them out of your disposal on the right person.
Oh my gosh. Ow. Ow. Oh my God. I'm definitely coming to New Mexico.
Oh yeah, wow. I can put my hands on the ground now. I got T-boned by a Prius.
It's always a Prius, I swear.
But when he hit me, I heard the femur snap. Like that was the first thing I heard. Like I just knew. The adrenaline's rushing. I went to get up and this leg just completely flopped over.
Did it go through the skin or?
Here it didn't, but this bone came, it was sticking out of my arm.
Those are
like
super
that far.
dangerous, man. Like you can get an infection.
Yeah, well I did. So this actually got infected. They did the surgery. It got like a staph infection because it wasn't taken care of properly. I spent 2 weeks in the ICU and they thought they were gonna have to amputate the foot.
Oh no.
Because there was a bad infection in it.
No.
You know what they did to save it?
What?
Leeches. They put medical leeches on my foot for 2 weeks straight.
And
Every
10 years
30
ago,
minutes.
Everybody was like, oh, a quack, oh, you never use leeches. And it's like, no, a lot of these old time therapies have a good use. Like there was,
they didn't come out of nowhere.
there is ancient wisdom, you know, like
I swear.
those things have been around for a long time for a reason. It's not just somebody made it up. There's a balance.
Yeah.
If you use the wrong thing in the right situation, same thing, using the right tool. An opioid isn't the hammer used for everything.
Right.
You know,
exactly.
surgery isn't the hammer used for everything.
Like when I got hit,
Yeah.
I'm not gonna want them to sprinkle some tea leaves over me and be like,
or have some chiropractor come adjust your leg. No, you need surgery.
yeah. So just putting my 2 knees forward, this one I can still go, and that one just comes up over.
Okay.
Which is, isn't that crazy?
It's a big difference for sure.
Huge difference. Oh wow.
Are you fixed?
Babe, this is insane. No, you have no idea. I literally was cracked from my tailbone to the top of my head. He pulled me apart and my entire back popped.
Damn, why didn't you call me? I would have loved to watch that.
Why weren't you down there? Like
was
it's
eating.
obviously it's on video, but like
It's not
it
the
was
same.
eating.
I want to see it in real life. Did it hurt?
No, didn't hurt at all.
Really?
Cracked my neck. It was I can't believe you didn't hear it upstairs.
That's not the stuff that hurts. It's the
I
other
feel
stuff that hurts.
like $1 million. It hurts a lot when he does the muscle stuff though. Like
Oh,
when
like
he
the
digs
moving-
in and
oh,
does
that,
the mobility
obvious.
Trigger point
stuff.
stuff.
Yeah.
Trigger. Oh my gosh. My whole brain was like.
Oh, I wish I wasn't pregnant. I want to try it. You can't do it while pregnant, can you? Hope
Depends
not.
what.
Can you crack my belly? No.
And down. She's so cute. She's like, don't hurt him. I love him.
She's She's just watching. I'm like, yeah.
Yeah.
No, she's like, yeah.
She's the opposite. She's like, hurt him more. Hurt him more.
Just a little harder.
That's for all the times it's irritated me.
Ah.
Oh, your
wow.
doesn't lift off the ground.
Yeah.
Yeah, it's like right to there.
There's
when it
still a
starts
little bit right there. Still see it, but
That's so much better though.
yeah.
I mean, before I would get to here and it start to come up.
Yeah, the first time we did it was pretty. And we haven't even worked on the calf either.
Yeah, because I'm feeling it pull like.
it's stretched now.
Yeah, that now I'm feeling a stretch. Before it wasn't a stretch, it was just
blocked.
it was blocked. Yeah.
Exactly. So you can't stretch it if it's blocked.
Right. Yeah.
So you have to do both.
That's what
things
you were saying earlier. Yeah, exactly.
with everything. You need both, right?
Yeah, because now I have the mobility in the ankle, and I'm starting to feel. Before, when I would go forward, I didn't feel anything in my calf.
Well, here's another good example. It's like, okay, I worked out, but if I don't eat, then I'm not going to get stronger or better, right?
Right, no,
and if you just eat a bunch of protein and don't work out, it's not going to do anything either.
It's just gonna get fat.
You have to do both. And that's what it is with like joint movement and then also muscle work or stretching. You have to do both if you really want change.
Yeah, that's good. Now I'm just getting to the stretch.
Yeah.
Like my heel's still down. I just feel it all back in here now. This calf doesn't feel tight at all, but just this one does.
Because you haven't been able to stretch it because the ankle's been.
What made you want to be a chiropractor?
My chiropractor in high school really helped me a lot. When I was growing up, like you were talking about, like Larry Bird, Michael Jordan, I was a huge fan of Jerry Rice and Emmett Smith and Joe Montana. All those guys were using a chiropractor every week during the season, which made perfect sense. You go out there and get tackled all the time.
Right.
You know, they'd have to get realigned. So I started doing that when I was playing high school football, and it made a huge difference for me. And my chiro back home, he was awesome. He didn't like try to sell me supplements or like long-term programs. He was like, man, when you have something, just let me know. We'll come and take care of you. I didn't know there was like weird ones.
Right.
Like new age, like
Yeah.
you know, so I didn't even have that idea that it existed. And we had a chiro that worked with our college football team too. Same thing. Like he worked hand in hand with the medical doctor and the team trainer and the physical therapist, and they would all sort of delegate. I was a biology major in college, and I thought I wanted to do it in a pharmacy. I think they said like 95% of all the jobs in pharmacy are in retail. I liked chemistry, but I didn't want to.
You don't want to sit in a lab and just sell.
I would rather sit in a lab than work. You know, not there's anything wrong with it, but I didn't really want to work at Walgreens or whatever. Like,
Right.
They make great money.
Just wasn't gonna make you happy.
Somebody that's ADD like me, I've got to move around and problem solve and have a little bit of ability to move and try new things. And even just like, you know, try different things on the body. Like you can't, as a pharmacist, you can't be like, well, let's just try this and this and this.
Right.
The doctor prescribed this, but
experiment.
I'm gonna give you a few of these, you know, so.
Oh, that calf is tight.
I've never worked with another chiropractor in my entire career. I've only worked with medical doctors and PTs.
Oh, really?
Yeah, so I'm so detached from the rest of that world.
Right.
Even though I know I'm like sort of becoming the face of that world, which is interesting.
Mm-hmm.
That's true.
It's cool though. They're both coming up at the same time.
Yeah.
My dad loved chiropractors. That's what kind of like got me to like reach out where I was like going through Instagram, and I had seen you a bunch. I was like, you know what? I've been having so many problems. I need to like find someone that actually knows the body, and it's not just like random here one-offs.
And done with athletes.
And my dad was always preaching about his chiropractor. Like he's like, oh, it's the best, it's the best, it's the best. And I was like, you know what? I'm doing it.
I did have one athletic trainer in college that was very anti, and he wouldn't let us go. And I really believe I tore my hamstrings because my pelvis was getting jammed from squatting 500 pounds. Mm-hmm. And I think that's why I tore those muscles, because I was out of balance, and you're putting crazy forces, but you're not moving equally.
Right.
And I mean, physics would dictate that it's going to find a weak point. You know, nothing's for everybody, but for me, the success I know that I had in the past with it in high school and stuff, with my hips coming off and me knowing it and getting adjusted and being faster and all those things, like I knew that my SI joint needed to get moved. Yeah. That's he hasn't had enough fiber.
Harder.
Shut up. Oh man, whoa.
Try that mission.
Oh. Wow. No shit.
Yeah, right?
That's nuts. I can never do that motion without pain. Not a chance.
Yeah.
Oh my gosh. This one feels like shit compared to that one. And this is my bad hip.
So I was just evening you out. Can't leave you crooked.
Keeping them extra.
No, because that's what
Working
happens.
them overtime.
Now the other one feels like crap. You're like, can you just do the other one real quick? I don't want to be uneven.
You enjoy this, don't you? Oh.
Are you acting or?
No, I'm not.
When the doctor is sitting, he has his hand in his pocket
pocket and do morphine or make him cry and scream. It's a magical.
So are you acting? That's what God. He said he has this.
His hands are like Hulk hands.
Take a watch.
See, that's what's wild. That's how you know. Like when he pushes on one side and it's like death, and then the other side you go over and it's like, all right, well, this is uncomfortable, but it's not horrible.
Yeah, and it's the same force. It's just, one side's messed up and the other one's not. And our bodies are compensating machines. Like we'll figure out a way to make it work, but at its own detriment eventually. Bring it back up. And down.
Oh,
And down. Good. Got her. Keep going. Good.
holy shit! What did that do? I feel like it opened the mobility up for my.
Yeah, basically what you're doing is as you're going backwards like that, I'm giving you a little boost to externally rotate the humerus, so it turns it inside the socket.
Wow, felt good.
Yeah, it looks pretty good. Good. And good.
What the hell was that? Holy shit. I learned a lot today.
All right, Big Dog, you're feeling good, so tell them where to find you.
Oh my gosh. Matthew _Noszka on Instagram. But the one you really want to reach out to is this guy. Don't forget about me. This dude is a lifesaver. I'm not even joking. I feel like $1 million. A lot of people are hearsay about like if chiropractors, this, that, and the other, physical therapists. It's the #1 thing that you have to do. You have to find a good physical therapist, a good chiropractor to keep you in line. Because if you're training, if you're doing anything for health and wellness, it starts from being symmetrical. And like for me, that was the biggest thing. I had a bunch of issues that are underlying in my ankle, my knees, my shoulder, my hip. So now that I've been adjusted and I feel like centered, I can continue to train, and I'm gonna use his tips. Thank you, man. I appreciate it. Seriously, I'm not even joking. You're a saint. Like, oh my gosh.